Welcome to Fit and Bold, where we promote healthy lifestyles. I'm your host, Lakita Goins. Today's episode is all about pregnancy and prenatal care. According to the Centers for Disease Control, about 4 million American women give birth every year. So today we're going to talk about pregnancy symptoms and the various stages, and we really want to emphasize the importance of prenatal care. So I have with me Dr. Dobaraya from the UAMS AHEC Area Health Education Center. How are you today?
I'm doing good. How about you?
I'm doing great. So, what are the earliest signs of pregnancy?
Most of all the women knows when they miss the period, that is the first sign.
Okay.
It's still possible that many times they will have the small spotting around that, but as they miss the first period and then they check themselves in 4 to 5 days, the urine pregnancy test will be positive.
Okay. What is the most accurate way to confirm a pregnancy?
Again, that's the same thing. Once you miss the period, wait for 4 or 5 days more if you are not sure. And by that time, if you get up early in the morning when you first pass your urine, check the urine pregnancy test outside available in the market. It can be just simple line or electronic, all of them are same almost. And that the time, if it is positive, that's the things.
Okay. So, if a woman finds out she's pregnant, what type of doctor does she need to see?
They have a couple of options. They can see the obstetricians, or they can see their family physicians, which many of the time they also do the deliveries in the hospitals. So either family physicians or the obstetricians would do the delivery in the hospital.
Okay, and so leading into that, I want to ask you about prenatal care, but first I want to emphasize how important it is. So I want to ask you just to briefly take us through a baby. What happens for a baby to form and be healthy at the end of a pregnancy?
So prenatal care's main aim is to prepare the woman to give the healthy baby as well as healthy mother for the future. So it is even the prenatal care start before you conceive the fetus or before you conceive. So if you are planning to be pregnant, you need to thinking about start taking the folic acid early enough, because the study shows the woman who take the folic acid, they have the less chances of intrauterine abnormalities compared to the others. So it is the study proven that as people who are thinking they plan to be pregnant in next few months, they need to start taking it.
Okay.
Beside that, like who are just find it out they are pregnant, still it is not late. If they haven't started taking the multivitamins, prenatal vitamins, they need to start taking it.
Okay.
So that is the one of the main thing. Once they find out they are pregnant, the first things by the first day of the last period to 4 to 6 weeks out, they need to schedule their appointment with their physician. Once they find out their home pregnancy test positive, I know it's a little bit early, but it is better to talk with your doctor and assess the things, what's going on in the life and everything, and go from there.
Okay. So when you make that appointment, a woman makes that appointment, what can she expect in that first visits with the doctor?
Yes. So first visit, they will simply come and talk with the doctor, but beside that, doctor also check again they confirm the urine pregnancy test one more time in the office that she is pregnant. They also check their weight, their height, their blood pressure. They also go about the history, like how many pregnancy, what age you start having the period, is there anything, any kind of complications runs in a family, as well as the general health of the mother. that mother has any pre-existing condition like high blood pressure, diabetes, all other things. And then in the examinations, might be doctor go and do the pelvic exam, as well as they do the pap smear. And towards the end of the visit, they might be, at first visit they might draw or might not draw the blood. If they didn't draw the blood at first visit, they generally do at 14 to 16 weeks, when the first time they check for the hemoglobin, for how the white blood cells doing, and all of the different things, as well as urine exams, looking for any sexually transmitted disease or anything, and those kind of stuff.
Okay, so from a woman's side, what can they expect as they go along into the first, second, and third trimester of pregnancy? What kind of changes will they see in their bodies?
Yes. So what is the means? The first, what the trimester is.
Right.
If we just divide the trimester word itself, it is dividing the total period in 3 equal time. So if we see the pregnancy is total about 9-month deal.
Right.
So each trimester is divided in 3 months.
Okay.
First month, as we all know, we first miss the period. And then the second thing, some women feel tired. Another is a morning sickness, and almost all women feel that things.
Okay.
After that, as the baby start growing inside over her body, she start having some emotional changes, as well as she start feeling her tummy start getting bigger, but it is not that big that she can notice. But if she is paying enough attention, she might start noticing some fullness in her lower part of the abdomen, as well as she needs to go for the pass urine much more frequently.
Right.
As well as she start maybe or may not have some constipation early on.
Okay. Okay. So now I want to talk about once you get past that last trimester, and I was reading about different delivery options for childbirth. Can you talk about that?
Yeah, generally childbirth is the main 2 options, either vaginal delivery or cesarean sections. In vaginal delivery, many of the time, because fetus in the distress or baby is in distress, or because baby is too big to come out through that route, that time they need to do C-section. Beside that, but many times there are the other options is there, like having the vacuum delivery. So they just put the small vacuum when baby is about to deliver, and not able to just pass the last part of the things. That time they put the cup, suction cup, on the baby's head and try to deliver. Another is a forceps delivery. They are the specially created instrument where they put around the head of the baby and try to help them deliver. And that's the main thing.
Okay. So I want to say, I know that there are a lot of teenage pregnancies, and I know they come with their own special risks. Can you talk to our audience about the importance of getting prenatal care, even if you're young and you're afraid to tell somebody you're pregnant? Just address that issue.
Again, for any health, if you come out and talk with your doctor or your family, that is the best things. Even in preteens, the pregnancy is, we know it is a risk, but at that point also having the prenatal care show really significant difference, like the survival of baby as well as the less complications in the mother. So they definitely need to, their family or patient him or herself need to come out and talk with the physicians about that, what they can do. They definitely need to quit smoking, quit drinking, as well as need to start, as soon as they find it out they are going to be pregnant, start the prenatal vitamins.
All right.
Those are the main things.
Okay. Is there anything else you would like to add to what has been said?
This is the many women thinks that they are fine, they don't need to see the doctor. But healthy mother give the birth to the healthy baby, and that will create the healthy society. So just be vigilant. Take the prenatal vitamins on time. Keep your doctor's appointment. Don't use drugs, alcohol. Stay away from the cigarette. Even the family member who are smoking, ask them to quit them, not for themselves only, but also for the upcoming baby. That will be the good one.
All right. Thank you so much, Dr. Dobaraya. This has been very informative, and I want our audience to stay with us because we're going to be doing some fit and bold recipes to keep the pregnant moms healthy. So stay tuned.
Try and avoid sneezing into your hand because you just contaminate them and then spread those germs everywhere. Focus on sneezing into your elbow, like this, and then you don't contaminate your hands. Turn on the water, wet your hands, apply a good amount of soap and lather up, and then focus on washing your hands for about 20 seconds, about the time it takes to sing Happy Birthday twice. Focus on washing the front of your hands, the back, in between the fingers, around the nails, and so on. And then rinse everything off. Use something to wipe your hands after that, preferably something disposable like a paper towel, and then use that to turn off the tap as well. If you get a chance, use that to also open the door to the bathroom as you're leaving. The best way to wash your hands is using running water and soap, but sometimes we don't have that available. So think about carrying with you a hand sanitizer. That should have at least 60% alcohol content.
For more information, visit www.cdc.gov or call 1-800-CDC-INFO.
Welcome back to Fit and Bold. Today's healthy recipe is vinaigrette dressing. Now, this is a last minute thing, I'll be absolutely honest, so we're going to work our way through it, but it'll be a good lesson that you can eat healthy even on the fly. So, what you need is vinegar, and it can be a plain vinegar or it can be apple or any other flavor will work. You'll need olive oil, and you'll need something to blend the two together. And so I'm going to use for my base a mustard. You can use brown mustard, and there are other things you can use as well. So first, I'm going to take the mustard, and like I said, I just bought it, so I'm going to open it up. And I'm going to put about 2 teaspoons into the bowl. And I'm just going to pretend like this is a proper measuring spoon, but that should be about right. You want to mix the vinegar with the mustard. And to do this, you want to have 1 part vinegar, 3 parts oil. And you want to go ahead and mix that up. And you'll see it start to smooth out. Now I got mustard stuck in my spoon. But it goes from being lumpy to pretty smooth like that. So now you're ready to add your olive oil. So first I have to figure out how to open it. Oh, well, another safety precaution in here. That's all right, at least we know it was a secure bottle. And you want to do, again, 3 portions of this to the 1 portion of vinegar. So I'm just eyeballing it again. And so again, the reason for the mustard is to blend the two, because the oil will not just mix with the vinegar, it'll settle on bottom. So if you can kind of see, I'm just going to mix this up really good, and you will see it start to blend. And if it doesn't blend as well as you want, you really have to get it going, and you'll see it start to mix better. But if it doesn't, then you may need to add a little more mustard. And I can smell the apples in this vinegar. So that's blended together pretty well. Now you can always add extra seasonings. You can add, I recommend adding some pepper, maybe some garlic, things like that, depending on what flavor vinegar you use, just to give it that extra flavor. But your dressing is ready. And so, improvising again, I'm gonna take this not healthy for you potato chip, but you please use lettuce or spinach, and I am going to try it out. It's a good salad dressing. So audience, you have a new quick recipe to make. Stay tuned.
What's up? This is my friend Rob from Michigan.
What's up?
He's a teenager.
Yeah.
He's pretty cool.
Woo! Hey, you want to slow down there?
No.
Really? Oh, okay.
What are you doing?
We're shooting a viral video. Hold on, I want to see this. Hey, this is his last 5 minutes on Earth. A little something to Mom? Say something to Mom. How about, goodbye, Mom, sorry.
Hello, my name is Latasha Cole, recent graduate of the University of Arkansas in Pine Bluff with a degree in Regulatory Science, Industrial Health, and Safety. I thought I'd be looking for a job right now, but with the help of my mentor, Alicia Farmer, and Career Services, I was able to land a position as a seed quality supervisor after training.
As a single mother, Latasha's motivation and determination helped her to earn 2 internships while on campus. UAPB can help prepare students like Latasha for the same opportunities.
UAPB prepared me.
UAPB TV 24 is looking for students and alumni to continue the UAPB Prepared Me commercials. We would like you to share your positive stories and experiences about how UAPB prepared you for your career path. Participants will also be interviewed on 89.7 KUAP. If you are interested, please use the contact information on your screen. Welcome back to Fit and Bold. I'm here today with Mr. Larry Westmoreland. He's a health coach and a certified nurse, and we're here at the Harold Complex Fitness Center. So, tell us what we're going to be doing today.
Okay, we're going to be doing part 2 of a continuation of the exercise I started last time.
Okay.
This time we're going to be standing, but we will have a chair for support. Now these exercises will be basically for people to really maintain balance. We know seniors sometimes when they start getting older, they get kind of wobbly, okay? So what we're gonna do is strengthen the legs and also help you with your balance.
Okay, everybody get your workout gear, get your water, and let's get ready to exercise.
All right, let's go.
Okay, so what are we gonna be doing next?
Okay, we're gonna be doing some standing exercises, okay? But we need a chair because we don't want anybody to fall. We want your right hand on the chair for support. Now you may see me doing it without the chair, but this is your first time, so make sure you hold the chair for support because I'm going to be raising my legs up, okay? And I'm going to be on one leg a lot. All right? Okay, everybody ready? Now the first exercise we're going to do, we're going to take our left leg up and we're going to put it on our right knee. And we're going to count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, let's try it on the right side of the chair, same exercise. Except we're going to change legs. Okay? So this time, we're going to put the right leg on the left knee. Okay? Everybody ready? Here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. What we're doing is trying to improve your balance. Okay, now make sure you hold on to the chair for support. Okay, next exercise. Left side of the chair, we're gonna take the left leg out and back. Okay, here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay? Right side of the chair, same exercise. Hold on to the chair for support. Okay? Everybody ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, let's get back on the left side of the chair. Now this one is a little bit more difficult. We call it stir the pot. We're gonna take our left leg up and we're gonna stir the pot. 1, 2, 3. Let's get some big circles. 4, 5, 6, 7, 8, 9, and 10. Okay, right side of the chair. Same exercise, right leg up. Let's stir that pot. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, that's real good. All right, right side of the chair, left leg up, left leg back. Okay, everybody ready? Here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, right side of the chair, same exercise. Am I going too fast for you? No. Huh? It's good? All right, here we go. Left leg up, left leg back. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, now let's get behind the chair. Slightly touch the chair and come back. Now, make sure you only slightly touch the chair, because if you go, it'll slide out from under you, all right? So make sure you just slightly touch it. 10 times. Everybody ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, we're doing good. Now, chair in the back. We're gonna take our right leg and place it. Take the left leg over the right. Okay, everybody got it? Here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, now we're gonna switch and do the other way. We're gonna take the right leg over the left. Okay, everybody got it? Here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, this particular exercise, left leg out front, and we're gonna turn it. Right leg, 66-degree angle. Okay? All right, everybody ready? We're gonna go 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, same exercise to the left. Okay, everybody ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, now that's one other exercise I really enjoy. We need a chair. Now the chair is for support, in case you have to do that. But really, we want you to 1, 2, all right? Everybody got it? You ready? All right, here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, all right. All right. Next exercise, right hand up. We're gonna put our left hand on our armpit, elbow, wrist, and 1. Okay, everybody got it? 1, armpit, elbow, wrist, and 1. Armpit, elbow, wrist, and 2. Armpit, elbow, wrist, 3. Armpit, elbow, wrist, and 5. All right, same exercise. Armpit, elbow, wrist, and 1. Armpit, elbow, wrist, and 2. Armpit, elbow, wrist, and 3. Armpit, elbow, wrist, and 4. Armpit, elbow, wrist, and 5. Okay, arms out. We're gonna rotate our palms back and forth, up and down. Okay, here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, now, on this particular exercise, I'm gonna have a seat. But what we're gonna do is take our right hand, grab our heel. All right, we're gonna do that 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9. I'm really gonna do 15. 11, 12, 13, 14, 15. Okay. Well, I believe that's it for today.
That was a great workout with Mr. Westmoreland. Remember, getting healthy is a lifestyle journey. If you have any questions, comments, concerns, if you want to participate, remember to email fitandbold@uapb.edu. Remember, the most important part is to jump right in, get fit, and be bold.